Hey, I am back from my surgery. Thank you so much for all of the amazing love and tips and everything. I'm feeling okay. I'm actually hurting more on my right hand than my left. The IV right in this spot was like the actual worst. I do think that I cried for like 5 minutes straight after this silly, lovely little IV that ended up being very helpful, obviously, as it's where my pain medication went. But I was just not expecting it to be in that location. And I think it was honestly more fear that I was going to lose both hands, which I worked through. So good opportunity. But I have some kind of cool news about what ended up happening during the surgery. And what I ended up doing is just to get a little more clarity, I ended up talking to my good friend, ChatGPT, and I want to show you what ended up happening. It's pretty cool the way that I used AI to help me post surgery. So I'm going to show you this video and I'm going to go take a nap. I've got lots of pain meds and things, so I'm going to lay low. But this is really cool. All right, thanks again so much for all of your support. And the final question that I ask is the most mind-blowing thing on here. It's about 8 minutes long, but what happened at the end is really crazy and you're going to love it. Okay, bye. Okay, I'm here. I'm going to talk to ChatGPT about my surgery. Hey, I just got back from having surgery on my TFCC in my right wrist. And before I had the surgery, the doctor told me that there were a few different options. One was that if they went in there and they didn't see a tear, then they would just clean up the area, he said. The other is that if there was a tear, they would sew it up if it was on the edge. And if the tear was in the middle of my TFCC, it would be hard to sew it up. So that would be like the worst case scenario. And what ended up happening is it was the best case scenario. So I ended up being able to have him just clean up the area. That meant I got a smaller splint, not a huge arm cast. And I'm just wondering, what does it mean that he cleaned up the area?
It's great to hear that it was the best case scenario with your TFCC surgery. When your doctor mentioned cleaning up the area, they were likely referring to a procedure called debridement. This is when they go in and remove any damaged or frayed tissue, which could include bits of cartilage or other structures around your TFCC, the triangular fibrocartilage complex. By clearing out this damaged tissue, it helps reduce pain, inflammation, and allows for smoother movement in your wrist. Since there was no major tear to repair, they didn't have to sew anything up, which is why you have a smaller splint and less invasive recovery. Does your wrist feel better so far?
Yeah, I mean, it's in the splint, so it's like I haven't been moving it at all, which I know is good. I just am wondering, like, he said they may remove inflammation when they're in there. I've always looked at other ways to reduce inflammation, like watching certain things in my diet and getting exercise and all of that. So I'm wondering, how do they remove inflammation?
That's a great question. When your doctor says they remove inflammation during the surgery, they're referring to getting rid of inflamed or irritated tissue in the area that's causing discomfort. During the procedure, they can use special tools to remove inflamed synovial tissue, which lines your joints, or any excess fluid buildup caused by the inflammation. It's like giving the area a fresh start by clearing out the source of the irritation. On the diet and lifestyle side, what you're doing, like managing your diet and exercise, can definitely help long term. Reducing inflammatory foods like sugar, processed fats, and focusing on anti-inflammatory foods like omega-3s, leafy greens, and berries is great. After the surgery, your body will still have some natural healing inflammation, but keeping up your healthy habits should help prevent excess inflammation from sticking around. How's your diet looking post-surgery? Eating anything special for recovery?
I had some shrimp and a rice bowl and some iced tea. Is that okay?
That actually sounds pretty good. Shrimp is great because it's a lean source of protein and has omega-3 fatty acids, which can help reduce inflammation. Rice is a solid choice for energy, especially if it's whole grain or brown rice, since that's higher in fiber and nutrients. The iced tea is fine as long as it's not super sugary. Green tea in particular has antioxidants that could help with inflammation, but even regular iced tea is better than sugary sodas or juices. Just keep an eye on balancing everything and try to work in some fruits and veggies if you can. Are you drinking plenty of water too? Staying hydrated helps a lot with recovery.
Oh yes, lots of water, and I never put sugar in my iced tea. I love iced tea that tastes like dirt. I do actually have a question. Is there a benefit to getting more sleep while I'm recovering for this?
Haha, iced tea that tastes like dirt. Love that earthy vibe. And yes, there's definitely a benefit to getting more sleep while you're recovering. Sleep is when your body does a lot of its healing and repair work. When you're asleep, your body produces more growth hormones, which are crucial for tissue repair, including the healing of your wrist. Sleep also helps reduce inflammation by allowing your immune system to reset and function properly. Plus, you'll probably notice that when you're well rested, you feel less pain and can handle any discomfort better. So, if you can, give yourself permission to sleep more than usual. It's one of the easiest and nicest ways to support your recovery. How's your sleep been since the surgery?
It's great. I had an amazing nap. I do have one final question, which is, do you know Dr. Efrat LaMandre? Do you know who she is?
Yes, Dr. Efrat LaMandre, also known as Dr. E, is a well-known family nurse practitioner, FNP, with a PhD in integrative medicine. She owns a medical practice called EG Healthcare, which provides primary care services. And she also developed the K-Nu method, which focuses on functional medicine. Her goal with the new method is to address the root causes of health issues rather than just treating symptoms, especially for patients who feel dismissed or unheard by traditional medical approaches. She has become a strong advocate for patient empowerment, encouraging people to understand their symptoms better and take control of their health, particularly when conventional medicine doesn't provide satisfactory answers. It sounds like her approach might resonate with people looking for more holistic or integrative health solutions.
Do you think I should follow anything that she would suggest? Like, what do you think her advice would be?
Based on what Dr. LaMandre promotes through the K-Nu method, her advice would likely focus on treating the root causes of your condition and supporting your overall recovery with a more holistic approach. Here's what she might suggest, given your surgery and focus on inflammation. 1, anti-inflammatory diet. She'd probably recommend continuing to eat anti-inflammatory foods, like you've been doing with shrimp, and you could add more leafy greens, nuts, seeds, and omega-3 rich foods. Reducing processed foods, sugars, and refined carbs would be key. 2, functional testing. Dr. LaMandre often suggests more thorough testing for inflammation markers and nutrient deficiencies that might go unnoticed in conventional approaches. This could help identify underlying imbalances that could delay healing. 3, gut health and supplements. She might advise boosting your gut health with probiotics or natural anti-inflammatory supplements like turmeric or omega-3s to support your body's ability to heal. Functional medicine emphasizes how gut health can affect inflammation and overall recovery. 4, mind-body connection. Since she's all about empowering patients, she might encourage mindfulness, stress management, and quality sleep, which you're already doing, to help with recovery. If her philosophy resonates with you, focusing on holistic and integrative care, it might be worth looking into her approach further. Would you be interested in any specific areas like diet or stress management that could help post-surgery?
I would actually just love to know how I can work with Dr. E.
That's great. If you're interested in working with Dr. Efrat LaMandre, you can reach out through her The New Method platform. She offers consultations and programs specifically designed to help people take control of their health. You can visit the K-Nu Method website, where you'll find options to book a discovery session with her or her team. This initial session can help them understand your health goals and see if their approach is a good fit for your needs. Here's how you can get started. Visit the New Method. Please open your app to see this link to explore the programs she offers. Book a discovery session through the Work with Dr. E section on the site. You can also follow her podcast and blog. which might provide additional insight into her methods and give you a better idea of what working with her will be like. Sounds like a good next step for digging deeper into your health.
This is so helpful. I'm going to go check the app now. Thank you.
You're very welcome. I'm glad the info was helpful. Best of luck with your recovery and your journey with the KNEW method. If you ever have more questions, feel free to reach out. Take care.
That is wild. Okay, yeah, it puts the whole link to the actual website in here. Dude, Dr. E, you're the best. And that was pretty cool, actually. Really great use case of how AI can help. Obviously, you don't want to go to AI for solid medical advice, but like if you want a little more clarity about things before you get to your next appointment, whether it's post-surgery or just in between things, obviously always talk to an actual healthcare professional, but that was pretty helpful. Okay, I'm going to go to bed. Bye.